Welcome to Healing Talks with Kingdom Docs.
Hi, I'm Dr. Hussein Musa.
I'm Dr. Adatone Musa.
In the previous episodes, we talked about the intentionality of our nutrition and our diet and how it affects our health.
Right, and in this episode, we're going to focus on something called medically directed nutrition or dietary therapy, and how that can help to treat, prevent, and even reverse some disease processes.
That is amazing. I like the sound of that. We're using food as medicine.
Yes.
And what better person than your physician to kind of lead this charge in healthcare without prescribing you a specific pill or injection.
Yeah.
We're just giving you advice and arming you with information to change your body, to positively affect your illness and make you live a better life. I think that's awesome.
Well, it certainly excites me because what it does, it also empowers the patient. The patient is being intentional with their diet and choosing foods that are good for their body and for their disease process. It gives them control, and it's something that is very rewarding to me. As an epilepsy specialist, there are many of my patients that suffer from seizures, and especially the patient population that suffer from refractory epilepsy, which are seizures that are not controlled. They are patients that are really discouraged. They're super afraid of even being in public because of their seizures and the risk of falling. They've tried many medications and even surgical interventions to prevent the seizures or stop the seizures, but they're still suffering from uncontrolled seizures and falls.
That sounds very challenging, and I can imagine how draining that is on the patient. But not just the patient, but their family members.
Family members, the patient, but there is definitely hope. There is something called the ketogenic diet or the modified Atkins diet.
Wait. I know about that diet.
Yeah.
That's what you use to lose weight, to get really shredded and get big muscles, right? That's
partially, yeah.
Okay.
And so it's a super popular diet these days because of weight loss. But for this particular medically directed nutrition, it's to treat seizures, reduce seizure frequency, and increase quality of life. Not so much weight loss, but that is a byproduct.
Wow, that sounds very complex. It sounds like you could get a lot of really important benefits just by being intentional about what you eat.
Yeah, and just to provide a little bit of history on the ketogenic diet, it's been around since the 1920s, so it's not a new thing. For treatment of seizures. In fact, it was more for the pediatric population. There's so many studies in the pediatric side that show that it works to reduce seizures, to treat seizures. In fact, some children who abruptly come off the diet will have more seizures, and then when the diet is resumed, their seizures are better controlled. But in the long term, it actually affects the person's genetics. So it's called epigenetic changes, where after a long time of being on the ketogenic diet, there are things that change in their genetics in their body. It causes permanent reduction of seizures. So if they want to kind of dial back on the keto diet and eat a little bit of pizza, and sometimes it's fine for that patient, and they are able to maintain seizure control.
That is amazing, that with the sustained effort of changing your diet and using your nutrition as a therapy, you can actually change your baseline genetics, but also change the disease process in your body.
Yeah.
And I believe that's amazing, that a patient can be almost healed of seizures or controlled of seizures without taking multiple medications that can have pretty deleterious side effects.
It truly is amazing. We are fearfully and wonderfully made, as scripture says. So it's something that we are implementing in our clinic, and we're going to delve more into how we are applying that to the adult population in the next episode.
All right, that's all the time we have. Please visit us at kingdomdocs.com.
Bye.